So let's have a look at cholesterol. It's a good time to look at it because the liver makes cholesterol. And by the way, it makes cholesterol according to the demand our body puts on it. And 80% of the cholesterol that the liver makes is made from glucose. And 20% of the cholesterol that the liver makes is made from fat. Now this information tells us straight away it's not the butter on the bread, it's the bread under the butter that's the problem. And that's what Atkins found. So let's have a look at cholesterol. There are two main types. One is high density lipoprotein called HDL, high density lipoprotein, and LDL. HDL is usually called the good guy, and the reason for that is it's the carrier. So it carries excess cholesterol from the blood back into the liver. That's why it's called the good guy. LDL is called the bad guy. But what you've got to remember is the body doesn't make anything bad. It has a role. So what is its role? Its role is that of a repairer and a rebuilder. So wherever there's damage, you're going to find LDL because it's the repairer and the rebuilder. But it plays another role. It delivers cholesterol to the brain because the brain loves cholesterol. Cholesterol to the brain. Now let me show you something briefly. We're going to look at this in further detail later. Glucose burns at 4 calories per gram. A calorie is a unit of energy. That's what glucose burns at. Whereas fat burns at 9 calories per gram. Can you see why the brain loves fat? Because fat is going to give more than twice the units of energy, and our brain cells, they're consuming fuel fast. Let's have a look at the blood vessel and how the cholesterol works in the blood vessel. Because of its low density, LDL is always on the edge. Because of its high density, HDL is always in the middle. Dr. Natasha Campbell McBride, who wrote the book Put Your Heart in Your Mouth, she spends the first 4 chapters of her book defining what damages the arterial wall. See, the arterial walls are lined with little endothelium cells, and chemicals damage them. Heavy metals damage them. There's your mercuries. Also, what damages them is mold. And we're exposed to, she defines, the reason why it's 4 chapters, she defines all the different chemicals. They're in toothpaste, they're in food. What's going to plug the holes up, students? The LDL cholesterol. That's its role, that's its job. So it comes along and it plugs up. If it doesn't plug the hole up, we would bleed into the tissues. Can you see that? So they're like the Band-Aid. But the person doesn't realise that the mouldy house is killing them. The person doesn't realise the 4,000 cigarettes, 4,000 chemicals that are in a cigarette. So they keep smoking. They don't realise the danger in their washing detergents, in their toothpaste. So can you see that it's still happening? And they read an article that says, no, mercury does not kill you at all. Well, I haven't read the science. You know, it's a neurotoxin. Can you see what's happening? Something else is happening. So all through the bloodstream, we've got little molecules of protein. When a person is on a high carbohydrate diet, releasing a lot of glucose into the blood, the glucose connects with the protein molecules, and these little combinations become sticky and they stick. And let's say we've got a narrow piece here and they come along and oops, they've caused a blockage. That is the number 1 cause of heart disease. That is the number 1 cause of a stroke, is this little blockage here from the movement of the combination of the glucose and the protein making it sticky molecules. On a low carbohydrate diet, you haven't got that process happening. To blame cholesterol for heart disease is like blaming the fire trucks for the fire. It's like blaming the ambulances for the accidents. Well, they must have caused it. Have you noticed that they're always there? Can you see that reasoning? We have quite a few books in our library at Misty Mountain, and I'll write them down at the end of the lecture. I realise I didn't write down yesterday's books. I'll do it all at the end of this lecture. The Great Cholesterol Con by Dr. Malcolm Kendrick. Notice what he calls his book. He's a cardiovascular surgeon, the Great Cholesterol Con. And this is what he said in his book. For the first time, normal levels of a normal, vital body substance is being called a disease. We have a book, an Australian doctor, Dr. Peter Dingle. His book is The Great Cholesterol Deception. We have another book called The Great Cholesterol Myth by Johnny Bowden. And there is an e-book by another cardiovascular surgeon, Dr. Dwight Lundell, called The Great Cholesterol Lie. We have another book called The Great Cholesterol Hoax. We're running out of words. And in her book, Put Your Heart in Your Mouth, Dr. Natasha Campbell-McBride, she's saying the same thing. These people don't know each other. They're from all over the world, and they've come to the same conclusion. It is not cholesterol. Dr. Ansel Keys, back in 1953, he put forth the theory that fat is causing heart disease. Did you hear that? So really by the 70s and 80s, it's big. Isn't that true? Fat phobia, that's what we call it. Fat phobia. So you know what they did in, I think, the late 70s? They created margarine to try and get people off butter to lower the heart disease. Has it? No. No, not at all. And what's the definition of insanity? To do what you've always done and expect different results. But something else has come up now, neck to neck with heart disease, and that is cancer. So that's one of the contributing factors. But something else has happened as a result, and this is well documented. You can search this one out. Margarine causes macular degeneration. That's a proven fact. So what else have they done to try and lower heart disease? Put everyone over the age of 40 on cholesterol-lowering medication, yeah? Cholesterol-lowering medication. Are you ready for the side effects? Dementia, muscle wasting, Alzheimer's, memory loss, and they've just added another one, breast cancer, because our sex hormones are made from cholesterol. I'll tell you a story to illustrate. I had a lady and a man attend my programs in New Zealand. I think that was about 2 years ago. They were in their early 70s. Tuesday night I spoke on heart disease, where I revealed what's happening with cholesterol, the truth on cholesterol. They came to me on Thursday. They said, we need to talk to you. I said, yes. The man looked at his wife and she just had her head down. He said, we're about to put my wife in aged care. He said she was leaving the iron on. We got to the point where we won't be able to handle her. He said, we came to your lecture and we heard what the cholesterol-lowering medication does. She's been on it for 10 years. It was Lipitor. There's a whole book written on the dangers of Lipitor. He said, so we stopped because they heard me say there will be a side effect to stopping Lipitor. Your memory will return. So this is a drug a person can be on 10 years and just stop. The side effects will be beneficial. He said to me, we're on our third day, and he said, I've got my wife back. He said, we are not putting her, we did not want to, but he said it was getting so difficult. And they both had tears in their eyes. How many people are in aged care with dementia and Alzheimer's and memory loss, and it's the cholesterol-lowering medication? I believe personally this verges on criminal, especially when you hear what I'm about to say. It was probably 5 years ago now at Living Springs Retreat. We had a scientist do our program with his wife, who was a nutritionist. They're both in their late 60s. She's 69. She said, I've been a nutritionist for 40 years. So she said, I was educated in university 40 years ago, and she said 40 years ago we were told that a cholesterol level of 300 and under was perfectly normal. Has the body changed? No. So can you see what medicine has done, they've dropped the levels. They now say that if you are over 190, you're a walking, talking heart attack. I have had people say that to me. One girl was 30, her cholesterol levels were 192, and the doctor said, you've got to go on cholesterol-lowering medication. 30! We had a pharmacist do our program. She said, this really annoys me. She said, I know it's only a money-making scheme. Because if you go on an antibiotic, you're on it for a week. If you go on cholesterol-lowering medication, how long are you told you're on it for? Life. Now, she said, I'm a pharmacist. I'm not against drugs. It's my business. But she said, this annoys me. You see, the brain needs fat. So, a study was developed or started, I should say. A study was started in the little town of Framingham. In the little town of Framingham, 30,000 people were assessed. This has been going for 30 years. They started it to prove that cholesterol causes heart disease, but it hasn't. It hasn't at all. Some people with low cholesterol levels are having heart attacks. We had a lady from England do our program. She said, I had a heart attack recently and I had a cholesterol level of 150. She said they did an angiogram, my arteries were clear. What happened there? She was under great stress. You know, great stress can constrict the arteries. There are many factors that come into play, as you probably can see. But what this study showed, the Framingham Heart Study, that's what it's called, it showed that people with high cholesterol levels don't get Alzheimer's. Why don't they get Alzheimer's? Because what does the brain love? Fat. So what's a good cholesterol level? Oh, probably 200, 250. So see what's happened? They've got many people on cholesterol-lowering medication. They've got everyone on the fat-free diet. And because you're not getting the feeling of satiation or satisfaction when you eat, the person eats huge amounts of carbs. They've lowered the cholesterol level so they can get more people on cholesterol-lowering medication, and people are eating margarine. Oh, surely all of that has reduced heart disease. No, it's still the number one killer in the industrialised nations today, neck to neck, as I said, with cancer.